Good morning, everybody. Yesterday we had 48,000 people come forward and get tested, which means the numbers are holding high in terms of the rates of testing. We desperately need that to continue to make sure we're capturing all the cases of community transmission out there. To 8 p.m. last night, we had 112 additional cases. And I want to stress the vast majority of these cases are family members or very, very close contacts. So family or close friends, unfortunately, bear the brunt of those 112 numbers that we've seen overnight. And that's why I want to stress again, as we did yesterday, if you put yourself at risk, you're putting your entire family, and that means extended family, as well as your closest friends and associates at risk. And the numbers are telling in that regard. In terms of the number of people that were exposed in the community whilst they were infectious, there are at least 34. And that is the number that we need to see as close to zero as possible before health will advise the government that the lockdown can end. So can I stress that is the number that we need to see go down to as close to zero as possible before we can get advice from health to say the lockdown can end. And it's critical. That's something all of us have a role to play in. All of us have to make sure that if anyone has symptoms, get tested and stay at home. Don't go to work. And under no circumstances should anybody be visiting another household. And certainly, more strongly, we want to stress that the virus is still concentrating in 2 or 3 local government areas. And as we did for the Northern Beaches, when we singled out those suburbs and local government areas where the virus was rampant, the vast majority of cases are still in the Fairfield local government area, and I need to call that out. Everybody in Fairfield should be staying at home unless they absolutely have to. Now, that is the message across everywhere in Greater Sydney, but in particular, when large numbers of the virus are circulating in one local government area, we must call that out so that people are aware and people can keep themselves safe and their family safe. We're also seeing, of course, a considerable amount of cases in the Canterbury-Bankstown local government area and the Liverpool Council local government area. They're the 3 main local government areas where the majority of cases are, but the vast majority of those cases are in the Fairfield local government area. And Dr. Chant will read out the specific suburbs. We need to call that out because that's where the virus is spreading the most. And we really want to stress that even if you regard yourself as an essential worker, especially in the Fairfield local government area, do not leave home if you have symptoms. Do not go to work unless you absolutely know that you don't have the virus. Because unfortunately, we're seeing very, very key workers, unfortunately, leave the home with symptoms or else not knowingly spreading the virus. So if you're a key worker or you work in multiple sites and you're from the Fairfield local government area, we would prefer you stayed at home unless you absolutely had to leave the house and unless you can assure that you're a negative COVID test before you proceed to your normal activities. And that is really, really important for us to stress. Again, it's up to all of us to see that number of exposures in the community go down. If you have the mildest of symptoms, get tested, stay home until health advise you otherwise. Please also do not go to your medical centre, a pharmacist or a GP if you have symptoms, because we're seeing people unfortunately turn up to waiting rooms of medical centres or GP clinics, or else going into pharmacies when they've got symptoms and unintentionally passing the virus on to other people in the waiting area or their GPs or pharmacists. And we need to make sure that if you have symptoms, your first stop should be to the COVID test and stay home until you get the results and you get the health advice. If you have symptoms and you need medical attention, please call and that medical attention will arrive. But we don't want to run the risk of people having symptoms, going to a workplace or going to a medical centre and spreading the virus. And that's really, really important for us to stress. So just to summarise, the 3 key areas we want people to focus on today and moving forward is, 1, it's a fact that if you get the virus, the next people who'll get it will be those you love the most. That is a fact. Number 2, too many essential workers doing essential work for all of us are leaving work with symptoms or unfortunately spreading the virus in their workplace, and that needs to stop. Do not leave your home if you have symptoms, and do not go to workplace, especially if you come from those local government areas that I've mentioned, if you suspect even at 1% that you might have COVID, you have to go and get tested and stay home until you get the result. And that is really, really important. And obviously avoid GP clinics or medical centres or pharmacists if you feel you might have the disease. Do not go into those areas, because unfortunately we're seeing medical practices have that happen to them. I also wanted to stress the New South Wales government has done some great work in the last few days in relation to the vaccine rollout. So from now, we'll be able to accept anybody over 40 who wants the AstraZeneca. As you know, the federal health advice or the regulatory advice is that over 60s can get AstraZeneca without any of those risk profiles that were identified. But if you're between 40 and 60 and want to get the AstraZeneca, you can go through the appropriate consent forms at all New South Wales health sites, which is very positive. But also we've had some outstanding conversations with the New South Wales Pharmacy Guild, and we're in the process of also allowing pharmacists across the state to provide AstraZeneca to anybody over 40. So please consider your own risk, please consider your own health situation, but know that you can get the AstraZeneca if you're over 40 in any of our pharmacies, well, soon, in any of our pharmacies across the state. We're in the process of making that happen, but certainly you can start making bookings through New South Wales Health mass vaccination hubs if you want the AstraZeneca over 40. And can I stress that in the coming weeks, some commencing next week, we will have mass vaccination hubs across many areas, as we've said, the Hunter, Wollongong, Macquarie Fields, and also Fairfield Showground. So we are expanding the ability for people to access the vaccine. And of course, the more doses we get, the more doses we'll get out the door. I'm pleased to say the New South Wales health capacity on its own is 200,000 jabs a week. And that's not considering the GP network, who we understand can do about as much as well. So we've increased our capacity, we've increased our access, and now all we need are those extra doses. And every time we get those extra doses, we'll make sure that they get into arms, which is so critical and so important. I want to stress again, we are in an absolutely critical phase of this disease. All of us want to get out of this lockdown as soon as we can. All of us want to reduce the stress we're all feeling. And we are the future is in our hands. It's up to us to make sure we get the word out. And whilst those 3 local government areas are where the most of the cases are certainly circulating, please know the risk is everywhere in those areas that we've asked for people to stay home. So the risk is everywhere, but we have to be upfront with where the virus is circulating at the moment, where people in those suburbs and those communities take extra care. And I know that the response in the last few days in particular has been quite distinctive, insofar as we've seen a massive reduction in mobility. We've seen increase in people doing the right thing. And as Commissioner Fuller, who I'm pleased is with us today, will also reinforce, today being the 12th of July, there's mandatory QR codes for a number of venues which didn't require them before. And police will be making sure that businesses and individuals are doing the right thing in that regard. But please know, we don't want crowding anywhere. So if you're waiting to check in somewhere, make sure you're socially distancing, you're wearing a mask. The last thing we want is people giving the virus to each other if they're waiting around to check in or what have you. Make sure you think about those things. But again, overwhelmingly, we just want people to stay at home. The virus won't spread if people don't leave home. That's the bottom line. Don't leave home unless you absolutely have to. We know where the risks are. We know how the virus is spreading, and we just need people to follow the information we're providing. Thank you. Dr. Chan.
Thank you, Premier. So there were 112 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and 46,478 tests. It's pleasing to see those test numbers remain high, but we have got more capacity. So we're suggesting and recommending a lot more testing, particularly in the areas of concern, so we can flush out any unrecognised cases and block those chains of transmission. Of the vast majority of cases are occurring in southwestern Sydney, southeastern Sydney, and we are seeing a small number of cases in Western Sydney and the Nepean Blue Mountains. I'm going to read out the key suburbs where we have cases, and it is important. The reason I'm reading these locations out is because we do need to make sure that every member of that community understands every time they go out of their house for an essential good, if they go shopping, they need to assume that someone next to them has COVID. Now, everyone across Greater Sydney should assume that, but we are conveying that in these areas, the risk is even greater. So when you are out and about for those very essential things that you need, please limit the time, go directly there, and make sure you're maintaining your social distancing, your mask is over your nose and mouth, and that you keep your social distance. The suburbs are Fairfield, Smithfield, Bosley Park, Fairfield Heights, Fairfield West, Wakeley, Bonnyrigg, Glenfield, and West Hoxton. Also, I just want to highlight that we are also seeing cases emerge among young adults in the 18 to 20-year-old age group, in the Georges River, Bayside, and Sutherland local government areas. And they're largely spreading it again, to echo the Premier's words, to their closest friends and family. So it's crucial that young adults also limit their social interactions at this time and also come forward for testing. In terms of New South Wales Health is also working with residents of an apartment block in the eastern suburbs, where we have 8 cases of COVID, and they've been identified in recent days across 5 households in a block of 29 units. We've now identified the source and we'll be working with all residents to ensure we can safely move and provide care for those with COVID in a special health accommodation and support the needs of all other residents who are close contacts and must remain in quarantine in their homes for 14 days. I just want to express my gratitude to the residents of the apartment block for working so well with us during a very difficult time. But this is a reminder of the risks that COVID poses and why we were requiring masks and have been in indoor common property areas of residential premises, and also discourage social gatherings or any gatherings across household groups in those apartment buildings as well. Just to highlight that, even if you're going to get your waste disposal, other points of contact, please see that as a risk as well. And please make sure that you've got your mask affixed and you keep that social distancing. In terms of the impact of COVID, let me say that we will be collating the information and putting it in our epidemiology report in terms of the underlying health conditions of people that are hospitalised. But I can say that you don't need to have an underlying health condition to be in hospital with COVID. COVID is a serious disease and is associated with hospitalisation in death. Obviously, the risk increases with age and for those underlying health conditions. We currently have 63 COVID patients admitted to hospital. We've got 18 people in ICU, 4 of whom are ventilated. 25 people admitted to hospital at the moment are under the age of 55, and 14 are under the age of 35. Of the people in ICU, we have 1 in their 20s, 1 in their 30s, 1 in their 40s, 5 in their 50s, 6 in their 60s, 3 in their 70s, and 1 in their 80s. Again, dispelling the notion that you are not going to get sick from COVID if you're young. But I think the most important message, because no one wants to pass on COVID, no one wants to infect their loved ones. So please stay isolated, get tested if you have the most minimal symptoms. Just to reiterate the Premier's comments, what we are requiring is that everywhere is subject to the stay-at-home provisions. But we're highlighting the increased risk in those areas. So it's Fairfield local government area, some parts of Liverpool local government area, extending into Canterbury, Bankstown local government areas. And obviously I've mentioned those other areas of southeastern Sydney that we're also concerned about. If you need to leave home, it has to be absolutely essential if you live in that, particularly the Fairfield local government area. Do not visit any other households. And if you're a worker, stay at home unless you absolutely need to attend work. So essential aged care, emergency services, healthcare, Other things that are critically essential. If you need to attend work, get tested before you go to work. And you don't need to isolate, but if you can delay going to work until you've got a negative test, that's much preferred. But if you have the most minimal of symptoms, you have to stay isolated until you've got a negative test. If you're sick, please call ahead. Do not go to your general practitioner with respiratory illnesses. Please call ahead and ask about what the care path is best for you. We want to protect our healthcare services and other patients in those healthcare services that are obviously amongst our most vulnerable. Also, if you're going to pick up a script from a pharmacy, or you're going to get Panadol or other pain relief and you've got COVID symptoms, don't do that. Get a test, stay isolated, and ask one of your other household members without symptoms to go in, but go directly into the pharmacy, pick up the medication you require and go home. We don't want to see any other opportunities for COVID to spread in healthcare settings. In regard to the vaccine message, please go and get vaccinated. Please contact your general practitioner, see if you can have bookings for the AstraZeneca vaccine and in some cases Pfizer vaccine, which is available through general practice as well as through New South Wales Health. If you've had the AstraZeneca vaccine within the last 4 weeks, we're asking that you ring your GP and they may be able to bring forward your booking to that 6 to 8 week period. Now, clearly having the vaccine within the 6 to 8 weeks trades off the duration of protection that vaccine might provide you, but we know that into the future we will be providing booster doses of various vaccines, and what we want to do is protect you. But my other message is even one dose of vaccine is worthwhile in improving your likelihood of hospitalisation. So please, even though the 2 doses is much more effective, even going forward and booking your first dose, we do want you to be patient to general practice, and general practice will try and meet those booking requirements, but we know that they will be prioritising the elderly as they work through. So if you are younger, please be a little patient with your general practitioner, but I would urge everyone to take up every opportunity to get vaccinated at this time.
Morning, Premier, and morning, ladies and gents. Overnight, we saw another 105 infringements written for non-compliance with the health orders across the greater Metro Sydney. Brings a total to 376 since Friday, since the police operation intensified. We also saw the same in cautions, nearly 400 cautions, showing that police will continue to work with communities, but there are still some who are not taking the message seriously. Can I say, since March last year, we've had around 40,000 calls to Crime Stoppers for people being concerned about COVID behaviour. Over the weekend, we saw 3,000 calls alone from members of the community who were concerned about COVID breaches. I think it's a stark reminder that most of the community get the issue, they get the health orders and the significance of them. The police operation will continue throughout the week, and if necessary, during this escalation of the health orders right across Sydney. However, we will focus on areas where the virus is, and obviously Fairfield is an area of concern at the moment, as well as Bondi and Sutherland. And I say the business inspections are up over the thousands as well. And obviously from today, we will be looking closely at those premises that don't have the QR codes. And it is helpful to have multiple of those within your premises. So from a police perspective, the operation will continue. We have seen an improvement with the behaviour of people, particularly in terms of wearing masks and the other health orders, and we'd ask that the community continue to work with us over the coming weeks. Thank you.
Hang on, James, sorry. Obviously, this virus has been a major problem in various parts of Greater Sydney now for the best part of 18 months. It has targeted various parts of Greater Sydney. It targeted my area of the Northern Beaches. It targeted Avalon. Right now, this virus is targeting Fairfield, friends and families. It's obviously also extending into the adjacent areas to a lesser degree in Liverpool, LGA and Canterbury Bankstown local government area. But my strong message to the community of Fairfield is this virus is targeting your families and your friends. It's effectively using family and friends to betray other family and friends by getting the virus into those households. Please be aware, right now, Fairfield is the target of this virus in particular. So make sure through every measure you avoid passing it on to your family, your friends. The only measure that will work is to stay at home. Just stay at home.
In relation to the hospitalizations, Dr. Chan, I know you mentioned that it was going to be the EPI report. That looks back to last week, so we won't get some of the information on these cases. Can you provide a sense of what comorbidities or underlying medical conditions these hospitalised people may have in general terms?
James, we'll work to get you some information on that. I think what's also clear is that from overseas experience, we can rely on the fact that we know people without comorbidities will end up in hospital. We will present the local data, but obviously that does take some time to collate, and we have to prioritise our approach to that data. So we will be collating it and making it public in the EPI report, and we'll try and get you some information around the ICU group and their underlying comorbidities for tomorrow's press conference.
Dr. Sharp, with the vaccination process, now, for people under the age of 40, if they want to go and get the AstraZeneca vaccine, they need to go to their GP, but then they need to book a second appointment because the GP needs to line up 8 people in a row in order to use the full vial of the AstraZeneca vaccine, which can be a couple of weeks away. My question is, why can't people who are younger, who want the AstraZeneca vaccine, after they've seen their GP, why can't they then go to a mass vaccination centre straight away and get vaccinated?
Look, we're happy to look at all opportunities. I think that the reality is, at the moment, we really need to prioritise getting older people vaccinated. So I understand that young people are potentially contributing to the spread of it because they're more mobile, but we are not the most important component of our response at the moment is to protect the community from hospitalisations and deaths. So the best focus we can have is getting our over 60s, then our over 50s, and obviously those with underlying comorbidities.
But is that something that you'd look at?
Is
having an approval from a GP to then go to a mass vaccine centre?
At the moment, we're happy to look at all options, but as I said, the one thing we are working so closely, and I want to thank the pharmacist and I want to thank the GPs for working so closely with us. We're looking at a range of options, but as I indicated, my messages are clear. If you're over 60, go and get vaccinated. If you're over 50, go and get vaccinated. We need to prioritise the resources in GPs, because the reason I read out that comment about being patient with GPs is the GPs themselves will have a finite limit on face-to-face bookings or encounters, and what they'll be doing is making those decisions that their 60-year-old will be much more important to have that conversation with and get them vaccinated. But we will be looking at options for broader age groups, and we're always open to those.
What prompted the change of advice? What prompted the change of advice for you can just go to a mass vaccination hub and get AstraZeneca if you're over 40 without seeing a GP?
So the current risk situation has changed dramatically. So the AstraZeneca discussion we've always felt best to have with a health professional that understands your clinical background and circumstances, and your GP fits that mould. And because at that time there was the Commonwealth was scaling access through general practice, it was considered that the best contribution we could have to vaccinating the population was focusing on our over 60s in our clinics, and also focusing on rolling up increasing our capacity to Pfizer. And I'd like to just acknowledge the work of the team led by Susan Pearce in health to actually scale up that vaccine capacity. So it's really been about where we can contribute most to the objective of getting vaccinated. But under the current situation, because we actually have COVID and the Delta strain circulating, it then means that your individual risk of acquiring the strain is very much different than it would have been a month or so ago, when your community risk would have been very low.
Dr. Sharon, this release says that New South Wales has asked the federal government that any unused GP Pfizer vaccines be redirected to health hubs. Has there been a problem with unused Pfizer vaccines?
No, I think it's suffice to say that we're really pleased that Pfizer is becoming available through a broader range of general practitioners. The Pfizer initially was rolled out through some GP respiratory clinics or rolled out through some very contracted providers to the Commonwealth to do aged care. At the moment, the Commonwealth is increasing access to the Pfizer vaccine for GPs. And what we're just saying is, if there is any operational lag in GPs using any doses at this time, we just don't want any to go to waste. But we actually are totally committed to rolling out in partnership with general practice and seeing Pfizer doses in arms, whether they be through our mass vaccination hubs or through the GP practices. But the key issue is we would not want to see any doses not being used. We will monitor the situation. All we've asked is that the Commonwealth monitor that, and if there is any availability to redirect some just for a week or so, and we can get them in arms, I think that's a win-win for everyone.
Sorry, Dr. Chan, just quickly. New South Wales Health considered using rapid antigen tests for people who are going into work rather than having then wait 24 hours for a PCR test as well?
Look, we're looking at the fuller range of testing strategies, and we are trying some novel strategies. At the moment, clearly any of those, the issue for the antigen tests is that they're not very reliable, but we need to review our testing strategy all the time. We now know that there are some technologies that are even shorter with a very accurate PCR testing capability, and we are deploying those in pilots. But my key issue is that we've got to learn how best to use those. They are a scarcer resource than our mass testing, and we are using it in some unique pilots, but I also need to keep that very focused on the highest risk close contacts.
The New England Journal suggests that frequency is more important than accuracy, and when you say that rapid antigen tests are not reliable, there are some achieving 99%, 100%, and if you have 10,000 of those tests versus 100 of the other tests, isn't it better to do the machine gun, scattergun approach as a first line of defence? Why is that not being adopted?
So in Australia, we actually have great testing capacity, and it's pretty easy to ramp up. So at the moment, you've probably seen some days ago that we've got testing capacity of 70,000 tests a day. So we are looking at bringing on board that. So we will consider all options. At the moment, our focus is using some of our very rapid PCR testing for 20 minutes in the highest risk groups. And also, if we have false positives, then that creates more work for us in working through it. So I'm open to looking at the antigen tests and its use, but at the moment, my key messages would be, please go and get a test. We are not exceeding our lab capacity, and we need to see testing levels much higher.
You concede, wouldn't you, that escapes quarantine? That's how it gets into the community, escaping quarantine, with people getting results, having left quarantine already, getting the results 24 hours later when they're potentially spreading it. That has been a number of the 27 breaches that we've seen. Rapid antigen tests find a result within 15, 20 minutes.
No, so that's not correct. The way that transmissions occurred in a number of the events is more complex than that. So the way transmission has occurred is we have a testing regime in our hotel's quarantine system where we test usually people on the way in. That sometimes can be at day 0 or day 2. And then we test them midstream at day 7. And then we test them again at day 14, towards the end around day 12 or day 13, okay? because of the 14-day incubation period. The transmission events have been different. There's been a variety of them across the nation, and some of the examples are where there's been transmission to people on the same floor. So that means that a person has developed the disease, we move them out to our health accommodation. But what's happened is inadvertently through airborne transmission, there's been a corridor, someone's had concurrent opening of doors, there's a variety of reasons people have become exposed. So the transmission isn't because we don't know their status when they get out, the status is that that person's been infected. So what happens is you then pick up transmission to that person may well have left. What we've got recommended now nationally is we do day 16 testing. And the day 16 testing is another, so people are discharged, but we do that day 16 testing, and we also advise another test at day 21. So that day 16 testing using PCR also does find people. And what it's been largely finding is we have found one person that was a reflection of potential transmission in the hotels. But what it also is picking up some historical infections that may not have got picked up.
That rapid antigen test. Sorry, no, just a small question.
Sorry. Yeah.
Premier, question. Do you concede now, since you've got 100 odd cases today, do you concede and agree with a lot of the experts that this lockdown will go for at least 3 to 4 weeks?
Oh, look, that depends on how quickly our community responds to those cases that are infectious in the community. It's really up to us, and the health expert advice will be based on what those numbers look like, and I can't be clearer than that. So at the moment, yesterday we had 34 cases at least where people were infectious, we understand, for the entire duration of their illness. Now that's the number we need to get as close to zero as possible, and I wish all of us had a crystal ball as to when that might be, because part of it, a large part of it, is dependent on all of us doing the right thing and being extra cautious. This is not the time to take any risk whatsoever, to say, I'll be okay, I'll just dash out and do this, or dash out and see my relative, or dash out and do something. This is not the time to cut any corners, quite the opposite. This is a time to sit at home and not leave home unless we absolutely have to, especially in those local government areas that we've identified. But across all of the stay-at-home areas, as we've seen, there's a smattering of cases outside those 3 local government areas. But it's important for us to call out that Fairfield local government area in particular, because the vast majority of cases are from that one local government area. So we know it's circulating in the community. So we won't know the answer as to how long the lockdown will take at this stage, because we need to know. We need to collect the data as to how we can get that number down. And can I just finish this one point? We know from both evidence and anecdote that in the last few days in particular, there's been a massive drop in mobility. People have heeded the warnings, people have heeded the messages. And once we see the impact of that, we will have a better assessment of the time that we think the lockdown will be in. But please be rest assured of one thing: as soon as we know, as soon as we get advice from the health experts, the New South Wales government will let the community know exactly what we know.
School situation's obviously hugely disruptive. Resuming tomorrow, what day can you give parents some certainty about when the kids, what their future is?
We'll make sure we give parents as much certainty as possible. But I do want to state, which I forgot in my opening remarks, that in those key local government areas of concern, we will be prioritising vaccinations for aged care workers and teachers. Now, they're not in the categories the federal government, well, the aged care workers were obviously in the federal government's responsibility, but we've stepped up and said we'll vaccinate aged care workers, and we're also going to welcome as priorities in those local government areas teachers who want to get vaccinated. Our priority is always about what life looks like once we get out of the lockdown, and getting out of the lockdown as quickly as we can and providing less stress for our citizens as quickly as we can. But I can't stress enough, that is up to all of us. We have a collective responsibility to make sure we all do the right thing, we don't cut corners, and it only takes a few people to do the wrong thing at the same time for us to be locked down for longer than we want to or longer than we need to. And that is why it's really important for us to focus on the fact that if you are in isolation already, if you're a close contact and you're at home in isolation and you get the disease, we're less concerned about you, but what we're worried about are people who knowingly are going out the house with symptoms, knowingly breaking the rules, or otherwise undertaking non-essential things outside the house, and that's what we need to stop.
Talk of a New South Wales style JobKeeper. When are you going to be ready to announce new business support for businesses?
Yeah, I can assure you that the New South Wales Treasurer, Don Perrottet, and I have been involved in very high-level discussions on an ongoing basis. The New South Wales Government has done a lot of work in this regard, and I hope to have something to announce within the next couple of days. So it's imminent, can I say? I'm sorry,
In terms of that, the business support grants announced 13 days ago. Applications for that aren't open. The eligibility criteria isn't even public. When is that going to be happening? Obviously, businesses need some help here.
Yeah, sure, certainly. The announcements we've already made in relation to business support was on the initial assumption that the lockdown would be for a fortnight, and that commences on the 19th of July. Obviously, what we announce in the next few days will have a mind on supporting businesses potentially for a longer period, depending on how long the lockdown lasts. And can I say this? New South Wales has done its work. We're in negotiations with the Commonwealth, and we hope to have something to say in the next few days.
It's the federal government that's dragging the chain.
All I'll say is I'm really confident that we will land a position we need to, but the New South Wales Treasurer, New South Wales Treasury has done outstanding work in making sure that we put our case and we take care of all of our citizens, and the Commonwealth has been listening. So I'm hoping we'll have something to say about that in the very near future. I want to assure our citizens that aside from what you might see or hear at 11 o'clock, there's a lot of work behind the scenes to make sure we cover every base and that we provide comprehensive support to our citizens. That's a nice question, yeah.
Testing of essential workers going to the regions, is that a requirement or a recommendation? And in terms of other protective measures, we're hearing some truckies are being turned away from local service stations. Can doctors go to cafes, all that sort of thing?
Look, at the moment, obviously, there's strong recommendations there because we don't want to seed the virus. We don't want to see the virus present itself in our regions. I want to thank the regional communities for helping us in that regard. Regional communities have been great at letting police or authorities know if somebody is in their town that shouldn't be, and that's the benefit of our regions, that people tend to know each other and people know when something's not right. But we also need to protect workers coming into the Greater Sydney area or those going to the Sydney area, especially around what we call those border communities, those suburbs or those regions where there's greater interaction than others. And so we're making sure that we don't leave any stone unturned. We're making sure that every opportunity we have to stop the spread of the virus, we're taking it, because what would be horrible is to stop the spread in key parts of Greater Sydney, but then to see the virus emerge elsewhere. So it's really important that we have a statewide approach, to making sure we prevent any seeding in communities where it currently doesn't exist. So just because your suburb isn't mentioned or your town isn't mentioned doesn't mean the risk isn't there. The risk is everywhere. And as we saw recently, there was a mining issue in Northern Territory. There were 600 miners from around the country who were exposed. Some of them were in New South Wales. Fortunately, it didn't spread to other areas, but it could have. So all of us have to be on our guard no matter where we live.
Premier, can I just ask a question? What else is being done to get the message out, particularly to those Southwest Sydney communities, because they're multicultural communities, also particularly considering it's going to be the Eid celebrations next week, and the latest vaccination advertisement by the federal government also didn't target those multicultural communities at all. Is anything extra being done to make sure the message is getting out there? And secondly, the Sydney Catholic schools have also offered up their schools as extra vaccination hubs. They said they've reached out to you. Is that something that you would consider?
Yeah, at the moment, can I stress, I can only speak for what the New South Wales Government is doing, and can I say I'm deeply grateful for all the communication that has been made to all of our communities, but also the community response. We've relied on community leaders who not only have the contacts, but also those deep relationships with people on the ground. And we've made sure we've used all of those in getting the message out. And the response in the last few days has been really positive. So, and I think what's really hitting home is people don't want to infect their loved ones, the ones closest to them. And that message has certainly been getting home. And I just want to thank all the community leaders that have supported New South Wales multiculturalism, our health authorities, but also other channels that we've used. So I personally made sure that I have a good line of sight on everything going on, and I'm convinced there isn't a stone unturned that we're using, and that will continue. But the message needs to get out to all of Greater Sydney. It doesn't matter what your circumstances are, what your background is, how many languages you speak. We're all in this together, and we need to support each other during this. And we know that some communities are more vulnerable than others. And we need to also accept that many of the workers we rely on come from southwestern Sydney. Aged care workers, tradies doing emergency work, cleaner, all these essential workers we rely on come, a lot of them, not saying all of them. So we need to support one another if we want to keep making sure that we keep going in terms of allowing us to have access to everything we need. It is obviously the health message, don't leave home unless you absolutely have to, but we also have to accept all the risks that are there, and those messages have been getting out.
On vaccinations, reports this morning that Kevin Rudd was able to have a negotiation with Pfizer and, get them to bring forward some allocations. If Kevin Rudd can get on the phone and get more Pfizer, what's stopping your government, someone from New South Wales, getting on the phone to Pfizer and getting more Pfizer for us, doing some kind of contract?
Yeah, but that's like asking me to interfere in foreign policy. I mean, because accessing, you should be asking those questions to the federal government in terms of
stopping the New South Wales government or someone in New South Wales from getting more vaccines for New South Wales?
Well, we have been urging the federal authorities for extra vaccines. If you look at my comments, not just recently, but over months, about the sense of urgency, I think every time I've spoken about vaccines, I've spoken about a sense of urgency, and that has been present in every comment I've made. Even when we had months and months of zero community transmission, I was had a sense of urgency. Our position has not changed. When we receive questions about who can receive the vaccine and what categories, we have to prioritise at this stage because we're waiting for the extra doses. So until we get the extra doses, we have to prioritise, as what Dr. Chant said, those priority areas, which are over 40s. But of course, if younger people want to access the AstraZeneca, they should go to their GP.
New South Wales went alone on PPE, Premier.
So what are you doing in terms of payments to encourage casual workers to stay home, even if they're ill, if they're waiting for a test result?
Well, obviously we're speaking to the federal government about that. National Cabinet had decided that the federal government would take care of individuals and state governments would take care of businesses. That was the agreement that was reached, and obviously at the moment I think it's a $500 payment offered to casual and permanent part-time staff. And that's something we're looking at as well in terms of the package we're going to announce. So that's on the table. I want to stress that. We don't want anyone to have a reason for having to go outside the home unless it's absolutely necessary. Let me make that very clear. So the package we announce will have that top of mind. We don't want anyone leaving the home unless they absolutely have to, especially if they live in those 3 local government areas we've identified. Who hasn't asked it? Has anyone not asked a question? Sorry. Has anyone not asked a question? Who wants one?
I haven't asked one. Just for Dr. Chant.
Oh, sorry. Yeah.
Just in terms of the lack of the JobKeeper wage subsidy. So did that have any influence on your decisions for allowing retail to trade during this lockdown? And if the federal government does, pony up the dough with more of a wage subsidy, will that change any of the restrictions for New South Wales?
Look, I think the key point, and I can't be clearer than this in my public health advice if I take off the mask. I can't be clearer that there is the orders and there are what we're expecting the community to do. We absolutely need to minimise our contact with anyone. And just to stress that, even if you're going to get a coffee at a takeaway and you know that you're going to be within 1.5 metres, you need to wear a mask. This is absolutely critical at this point in time, that we minimise at all our contact with anyone else. I think that is a simple message, and everyone has a role to play in achieving that outcome, because otherwise this disease will continue to spread and have a tragic consequence for those that are most nearest and dearest to you, including your friends and closest family. And for me, that wouldn't be a consequence I'd like to see. And so every time we move about at the moment, we need to see threats. I'm not trying to overplay this, but if we all do that, that will mean we get out of this situation quicker. And I'm also very understanding of the incredible impact the lockdown is having on individuals. I understand that. So if we can work together across business, community, and government services to support the community, then that will give us a greatest chance of the shortest period possible. But if we don't, it is going to be a hard ask for us to continue to see no spread.
Sorry, Dr. Chan, but if the wage subsidy does lift, if it is boosted, would that change health restrictions?
They're a matter for government. What we're trying to say is very clearly to every member of the community. Even if it is going to the supermarket and you think walking around the supermarket is giving you some freedom, I'm saying don't. Go to the shop with purpose, shop with a list, get in and out of there as quickly as possible, make sure you're wearing your mask appropriately and limit your movement. Remember, only one person from the household is only able to go out. And if you don't, and we're not saying that that's an entitlement every day. If you don't need to, do the shop. Don't go out for a week for shopping. We're really asking everyone in the community to limit at all your contact with anyone outside your household and get tested at the most minimum of symptoms. Work from home if it's all possible. And if you're in these local government areas, get a test.
Doctor, given these figures today would refer to the before Friday period, with all the modelling that you do and your experience over the last 18 months, when would you expect, if everyone does the right thing, the numbers to start turning?
So we're managing two risks here, because what we need to do is there may be stray infections in the broader community, hence why we have the restrictions across Greater Southwest, where we need to make sure that individually we are stopping the chance that even if we have the disease, we're stopping its spread. But also what we're seeing is transmission within households and extended family. And really, I'm so pleased to see the messaging is better understood. And we're certainly seeing the feedback from the community that they are having less movement between our households. And as I said, I can understand the challenge in that many of the households are large and how they define family is very different, in the sense that the family is very much an extended family. But we have to stop that. For this purpose, the only people we want you to interact with is those people that usually reside in your home.
If the numbers, for instance, don't turn this week, the trend doesn't improve this week, do you then recommend to the Premier tighter restrictions for retail, for instance?
We assess the risks every day, and what forms our messaging to you is a concern about the risks. So what we're concerned about is protecting ourselves from seeding, and so the advice around non-essential work, testing in Fairfield, we're assessing all of the risks every day, and we provide updated advice to the government.
Do you believe this is a peak today, or do you think it will go higher than 112?
Can I just say I'm in two minds about that, because if I can find all the cases out there today through really, really high testing, that's actually a win. Because what I want to do is actually find every single person who currently has COVID or is at risk of COVID. So even the numbers are a bit variable, because we have to interpret about whether we're getting to people in that, early. If we're getting to people really early when they're just turning infectious, then they've probably had that chance of not infecting it further. And if we can contain the family unit, we can stop the spread. So the numbers also have to be interpreted with some on-the-ground understanding. And so, yes, I would say I'm in mixed minds whether I need to have a larger number tomorrow. Obviously, in the end, I want to see it going down. And I also want to see that more people are in isolation, or even if they haven't been in isolation, they've been staying home. Because actually, if you're staying at home, you're effectively isolating from the community. You may not have been isolating from others in your household, but you're effectively been isolating. And that's the whole idea of the stay-at-home orders. To infect, if we find someone is positive and they've actually not been to the shops, not been to a pharmacist, not been to a medical centre, then really there has not been any extension of community risk. They've actually been essentially isolating. So those are the factors that play into our decision making.
Are schools being advised to prepare for at least a month's online learning right now?
Can I say, even when the lockdown commenced, because we weren't sure what we'd uncover, what the case numbers would be, our New South Wales Department of Education, in consultation with Catholic and independent schools, does have a number of contingencies. We always plan for contingencies because we want to provide that certainty to parents so that no matter what decision is made based on the health advice, that those arrangements are in place. And I just want to really thank, in particular, the New South Wales Department of Education, the independent school system and also the Catholic school system for working so closely with us to make sure that no matter what health advice we receive about schools in the coming weeks, that we're able to act on that very quickly to keep our schools as safe as possible, but also make sure that all those arrangements are made so that no child is disadvantaged no matter what the health advice is. And that's really important. So please know that those contingencies have been going on for some days now, that planning work, to make sure that whatever health advice we receive, we're able to implement in a good way. I'm sorry.
New South Wales went alone to get more PPE, New South Wales went alone to get more ventilators. What's preventing New South Wales from going alone to get more vaccines from the international community?
Firstly, I'll say that New South Wales government never leaves a stone unturned. I'll leave it at that, but also say that it is not the state government's responsibility, which is a fact, to source the vaccines or to get the doses. It's our responsibility to get jabs in arms as quickly as to support the government. And mind you, it was because we urged the Commonwealth to let us do that. So the up to 200,000 jabs a week that we're able to do wouldn't have occurred if we'd not said to the federal government, let the states have a role in this as well, in addition to the GP network. So please know the New South Wales government always does what we can, but there are certain limits to our powers and what we can do. But know that we're always pushing the boundaries to see what we can do to improve the situation for our citizens. And that's why, and I do want to thank the Treasurer, Don Perrottet. He in particular with New South Wales Treasury has worked really hard to put together what we believe is the best package moving forward. And we hope to have to say something about that along with the Commonwealth in the next few days. I'm sorry?
You said no stone unturned. Does that mean that you have tried to get vaccine on behalf of New South Wales?
Oh, I'll just leave my comments at that. I don't want to get into specifics. Can I make very clear, the New South Wales government will do what it needs to provide support to our citizens, and I want to make that very clear. And we've made that clear to everybody that first and foremost what is important to us is the health and well-being of our citizens. That includes not only keeping them safe from COVID, but also making sure they don't feel the financial stress of what we're asking them to do. I don't want anyone to have a reason to leave the house unless it's absolutely necessary, and we'll make sure that the support we offer ensures that's the case.
Premier, so just on that, if the subsidies are boosted, will that change restrictions? Will you shut down non-essential retail?
Oh, look, I don't want to delve into hypotheticals. The community has enough to deal with at the moment. Please know that every bit of advice we give you, every decision we articulate is based on the science and based on the health experts, and that will continue to be the way. I don't think it's helpful talking about scenarios at this stage, but what I have said very clearly is given where the numbers are, it's not likely, in fact, almost impossible for us to get out of lockdown on Friday. But we will be able to provide you further information as soon as that comes to hand. The length of the lockdown will depend on our ability to come together and to follow the advice across the state, I want to say, because it would be a big irony if we did all the hard yards and got rid of the virus in certain parts of Sydney and then had it creep into the regions. And so all of us have the accountability to do the right thing because none of us wants to be in this situation for longer than we have to be. Thanks, everybody.